contraction and ends with the beginning of the next contraction. Afterload is defined as the pressure in the aorta against which the left ventricle must pump. Which of the following two factors directly affect cardiac output? Stroke volume and pulse rate. Which of the following statements regarding blood flow is correct? Ejection fraction is the percentage of blood that the heart pumps per contraction. Hemoglobin functions by binding to oxygen that is absorbed in the lungs and transporting it to the tissues. What aggregates in a clump and forms much of the foundation of a blood clot during the process of coagulation? Platelets. Perfusion is defined as the circulation of blood through an organ or tissue in amounts adequate to meet the body's demands. Which of the following organs or body systems requires a constant blood supply, regardless of external factors? Kidneys. Which of the following organs can sustain the longest period of inadequate perfusion? Gastrointestinal tract. An organ or tissue that is considerably colder than 98.6 degrees Fahrenheit is better able to resist damage from hypoperfusion because the body's metabolic rate is slower. The amount of blood returned to the heart is called preload. External bleeding would be the most difficult to control in a patient with a large laceration to the blank and a blood pressure of blank mmHg. Carotid artery, 100/70. Patients with internal hemorrhage will benefit most from rapid transport. What is the approximate total blood volume of a 150-pound male? 4.8 liters. The most significant factor that determines how well the body compensates for blood loss is the period of time over which the blood is lost. Venous bleeding is more likely to clot spontaneously than arterial bleeding. Which of the following factors would have the most negative effect on the body's process of hemostasis? Anticoagulant use. If you suspect internal bleeding during the primary assessment, you should keep the patient warm and administer oxygen. Hematochezia is the passage of stools that contain bright red blood. All of the following are common early signs or symptoms of non-traumatic internal hemorrhage in older patients, except vomiting. Most external hemorrhage can be controlled with a combination of direct pressure and pressure dressings. What is warm ischemic time? The period of time that organs and tissues can survive without perfusion, assuming a normal body temperature. Much of the bleeding associated with unsplinted fractures continues because bone ends will continue to move and destroy partially formed clots. When applying a tourniquet to control major external hemorrhage from an extremity injury, you should maintain direct pressure to the wound until the tourniquet has been fully applied. Agents such as Chilox, Humcon, and QuikClot are used to promote hemostasis. A patient with hemorrhagic shock would be expected to have flattened jugular veins. Which of the following injuries or mechanisms would most likely lead to non-hemorrhagic shock? Severe burns. A trauma patient with suspected internal hemorrhage and inadequate breathing requires ventilation assistance and rapid transport. A trauma patient with hypotension secondary to internal hemorrhage should receive IV fluid boluses in order to maintain the systolic blood pressure in a low normal range. Which of the following types of medication would most likely reduce a patient's ability to compensate when in shock? Calcium channel blockers. Confusion, a sustained heart rate greater than 120 beats per minute, and a respiratory rate of 32 breaths per minute are most consistent with class blank hemorrhage? The third. A healthy adult can tolerate blood loss of up to blank ml over a period of 15 to 20 minutes without any negative effects. 500. The physiologic process of hemostasis is achieved through vasoconstriction and platelet aggregation. In contrast to a patient with compensated shock, a patient with decompensated shock would be expected to present with mottled skin and dilated pupils. A fall in blood pressure and the resultant changes in plasma osmolality cause the release of aldosterone and antidiuretic hormone. Circulation of blood within an organ or tissue inadequate amounts to meet the cell's current needs is called perfusion. Which of the following types of shock is caused by poor blood vessel function? Septic. If you discover minor external bleeding during your primary assessment of a patient, you should make note of it and continue your assessment. The paramedic's main goal in treating a patient with shock is to recognize the signs and symptoms of shock in its earliest phase, and begin immediate treatment before permanent damage occurs. Decompensated shock in the adult is characterized by a falling blood pressure. Which of the following signs would you most likely observe in a patient with compensated shock? Anxiety or agitation. You are treating a 20-year-old man with a large laceration involving the brachial artery. The patient is confused, is pale, and has weak peripheral pulses. Your initial attempts to control the bleeding have failed. You should apply a proximal tourniquet, administer high-flow oxygen, transport, and establish vascular access en route. A motorcycle rider struck a parked car and was catapulted over the handlebars of his bike. Your assessment reveals that he is tachypneic, diaphoretic, and tachycardic. There is no gross external bleeding present. What is the most likely cause of this patient's clinical presentation? Bilateral femur fractures. You have successfully controlled a large arterial hemorrhage from a 42-year-old man's leg with direct pressure and a pressure dressing. He is conscious, but restless. His blood pressure is 84/58 mm Hg, pulse is 120 beats per minute, and respirations are 24 breaths per minute. You should administer high-flow oxygen, keep him warm, transport, and establish 2 large-bore IV lines en route.